Start. You're muted, Minister.
No, she
Oh,
isn't.
sorry. It might be at our end here. We'll check our end here.
Just ask the minister for a thumbs up.
Minister, could you just try your mic again? We'll.
Testing, testing, testing.
Perfect. Will the Committee of Supply please come to order? Before we begin, we have a leave request for this section of the Committee of Supply. Is there leave for the opposition to sit on this side since the minister is doing virtually? Leave, agreed. The floor is now, this section of Committee Supply will now resume consideration of the estimates for the Department of Health. Questioning for this department will proceed in a global manner. The floor is now open for questions. The member for Union Station.
I'd like to ask the minister some questions in regards to northern and rural health. My colleagues, while in question period the last couple of days, have had the opportunity to raise concerns around Powerview Pine Falls, and concerns in the Interlake. And we haven't gotten any clarity from the minister in any of those regards. It was actually very concerning a couple of days ago when the minister referred to First Nations nursing stations and talked about federal jurisdiction when our colleague, the MLA for St. John's, I believe, asked a question about the emergency room being closed at Powerview Pine Falls Hospital. And so first I'd like to ask the minister kind of broadly, as the Northern, we know that the Northern Regional Health Authority is referring to situations at several northern sites at facilities as very fragile. And this is something of concern. It's been of concern for quite some time. My colleague, the MLA for Flin Flon, has raised this in the House as well. And so I'm wondering, with all of these concerns having been raised, and the minister is well aware of the concerns at several northern sites, and I'm sure she would agree that, what's going on at these sites is not okay, that the situation is indeed very fragile. What is the minister doing to shore up these sites and improve the circumstances?
Before I recognize the minister, I just wondering if the minister's staff was able to check whether or not she would be able to use headphones on her headset, just for the Honorable Minister of Health.
Thank you, Mr. Chairperson. I thank the honorable member for Union Station for the question. I would like to seek clarification before I respond to the member's question. Can the member clarify the information they are needing on Northern Healthcare? Because the question was packaged in there are a number of minor questions that were part of the larger question. So Northern Healthcare, what is the information the member is seeking? Thank you, Mr. Chair.
The member for Union Station.
There are several northern sites that are struggling, and the facilities have been described as being very fragile as a result of lack of staffing capacity. And so my question is, what is the minister doing to shore up these northern sites that are in a precarious state due to issues like staffing shortage crisis, as just one example? What steps is the minister taking to shore up these facilities so that they are no longer in a very fragile state and people are able to access healthcare in these northern facilities in a timely way, in an accessible way close to home?
The Honorable Minister of Health.
Thank you, Mr. Chairperson. I'm pleased to respond to the honorable member for Union Station's question. Our government has given $4.3 million for 37 additional nurse training seats at the University College of the North. This is part of our larger plan to add close to 400 new nursing education seats. In budget 2022, our government has committed $812 million, the largest single healthcare commitment in Manitoba's history, to improve rural and northern healthcare. A significant portion of the $812 million will be used in the creation of a new intermediate healthcare hub in northern Manitoba. And currently teams are engaged with Indigenous leadership and stakeholders to help lead the co-plan of these projects. And we are excited as a government to be working with our northern partners to reduce the need to travel to Winnipeg and allow for better care closer to home. Mr. Chairperson, I was so pleased to be in Thompson on May 19th, meeting with several stakeholders from the north and Thompson and surrounding communities. EMS was represented. A number of program areas were represented, emergency and others, and we were at the table of solutions, looking for ways to address the staffing challenges and some of the temporary closures that are occurring. One of the things we talked a great deal about were initiatives under the Clinical and Preventative Services Plan. And this plan sets a great foundation for moving our system ahead, especially in northern areas, as the member has queried about. So this will allow for a building and expanding 38 healthcare facilities across rural and northern Manitoba, which will improve access, quality, and reliability of care, reduce our wait times, increase our nursing staff, improve diagnostics, emergency medical services and patient transport, create new hospital beds and personal care homes. We're using an Indigenous partnership strategy that will be collaborated and co-designed with Indigenous leadership. And it's certainly to reduce the need for Manitobans to travel long distances for care by providing more care closer to home, Mr. Chairperson. And with all of this, our government has has over doubled the NDP's funding of the Northern Patient Transport Program as well, from 7.9 million to 18.1 million. So we continue while these projects are under construction and have not fully been implemented yet, to assist nearly 20,000 patients a year in terms of Northern Patient Transport to receive the care that they need. I also want to talk about some of the projects that have already been completed. In 2016, Grand Rapids and Moose Lake, new nursing stations and residences for a total of $18.4 million. In 2016, Thompson, the Northern Crisis Center for Youth, $7.8 million. In 2019, Flin Flon, new and expanded emergency department, $27.1 million. In 2019, Snow Lake and Lynn Lake, new ambulance stations in each community, $1.5 million. And in 2021, Thompson, new and expanded medical device reprocessing department. So I'm pleased to place that information on the record to inform the honorable member for Union Station about some of the incredible investments our government is making in rural and northern Manitoba, and more good news to come. I see a long list of planned projects that will be announced shortly that will continue to expand on the Northern Intermediate Hub, provide more treatment spaces, more staffing in those communities such as Pine Falls that the member has referenced. And we will continue to work with the leadership of the Interlake Eastern Regional Health Authority in terms of their intermediate, medium-term plans to address the increased nursing staffing challenges that they have seen since November of 2021. So we are in talks with them and look forward to sharing some of their plans.
The
Mr.
minister's
Chair.
time has expired. The member for Union Station.
I'd like to, I'm going to keep asking questions about healthcare in the north and in rural communities. This is a really important area that, under this government, unfortunately, hasn't seen the investment necessary. And the minister references the Clinical Services Prevention Plan, which, in conversations I've had with many folks in rural communities, they're incredibly concerned about the rolling out of that plan and the moving forward with that plan, given how they've seen the government's decision-making around the healthcare transformation impact healthcare in Winnipeg. It's been devastating. And so understandably, people are very concerned about what that means for rural and northern communities. And we're seeing the impacts actually already with these incredibly long wait times for things like paramedicine services in rural communities, folks trying to access emergency rooms and being forced to access multiple emergency rooms in order to access care in those important moments. So specifically now, what I'd like to touch on here is the issue around obstetrics. Now, this is an area that I want to highlight and thank community organizers and advocates on this particular issue. And there's one group specifically called We Want Birth Committee. These folks are amazing, and they have been advocating on the issue of obstetrics being in their communities. Specifically, I'm talking about Thompson, the PAW, as just a couple of examples. And, those folks highlighting that people should be able to give birth in their own communities and access care in that manner in their own communities and not have to be flown or drive out south for that care. And they fought really hard for this government to take their concerns and their lived experiences seriously. I'd also like to acknowledge our colleague, the MLA for Notre Dame, for her work with this committee and her advocacy on this particular issue and drawing attention to this matter. It's really important. So both Thompson and the PAW were experiencing very significant staffing challenges. I know the minister is well aware of that. Can the minister provide an update to us on the current staffing situation for obstetrics at Thompson and the PAW?
The Honorable Minister of Health.
Thank you, Mr. Chairperson. I would like to go back to the honorable member for Union Station's earlier question specifically about Pine Falls and what is being done. I do want to share that we have been in conversation with the leadership as well as the site, and they have provided plans in terms of intermediate and medium-term plans for that hospital. So in terms of the immediate term plan, they have listed to build up emergency department access and services to next or nearest ED at Pinawa Hospital. IERHA's putting in place a medical transportation plan with shared health, ERS, that supports patient movement in this operating environment. IERHA is building more robust access to primary care services 7 days a week, including evenings in Pine Falls. Leadership is pursuing filling both the posted vacant positions and every shift that is currently not filled. IERHA has developed and is implementing a robust communication plan for staff, communities, and local partners. And Mr. Chairperson, again, those were the immediate term plans. The medium term plan is to build a site nursing education plan that helps support increased ED capacity, build a Pine Falls site recruitment plan with human resources and other partners. This recruitment plan will also include a longer term training and education plan for local schools and communities. And they are saying that they will engage with local communities for sustained community-driven workforce development options. So this is something the Interlake Eastern Regional Health Authority and our government takes very seriously and is a priority for us, which is why we asked the Interlake Eastern Regional Health Authority to work with the hospital staff. Again, ideas coming from the hospital floor to look at ways that we can support keeping that emergency room or emergency department open. I also want to share with the member, because they had asked about our investments in rural and northern Manitoba. 2.3 billion in our targeted healthcare capital plan is for projects. 141 million for St. Boniface Hospital emergency room redevelopment, tripling the size of its ER. $8 million for the new acute stroke unit at Health Sciences Center. Again, the $812 million for the clinical and preventative services plan. $283 million for a 90-bed new hospital in Portage-La Prairie. $127 million for a 60-bed new hospital in Nipawa. $70 million to enhance and add 30 additional beds at the Brandon Regional Health Center, $32 million to enhance and add 23 additional beds at Steinbach's Bethesda Hospital, $64.4 million to enhance and add 24 beds at Boundary Trails, $31.6 million to enhance and add 30 additional beds at the Selkirk Regional Health Center, and that is in the Interlake Eastern Regional Health Authority. $5 million for a new emergency department in Dauphin, and $10.8 million to enhance and add 12 additional beds at the Lakeshore General Hospital in Ashern. So, Mr. Chairperson, some very significant investments are going into these areas, and we have asked the Interlake Eastern Regional Health Authority to let our government know how we can support those immediate term plans and the medium term plans to ensure Manitobans in that region and in the surrounding area can access Pine Falls Hospital for the care that they need. It is not the intent of the IERHA to frivolously or close hospitals and emergency departments. They do so with a plan. That plan is in place, and we are here as a government to come alongside the IERHA and Pine Falls Hospital to support them, whether that is financial investments, whether that is with a recruitment plan. Our goal as a government is to support the IERHA and the Pine
The
Falls
Honorable
Hospital.
Minister's time has expired. The member for Union Station.
Certainly, I think everyone, quite frankly, commends the Interlake Eastern Regional Health Authority for their efforts around this particular issue. They sent out a notification that did include steps that they were taking to make sure that folks could access care when the emergency room was closed ahead of the long weekend. It's an incredibly important facility, and of course, I commend the Regional Health Authority and healthcare providers on trying to find solutions to address a really concerning situation. And I've heard all of the steps that the Interlake Eastern Regional Health Authority is taking and the steps that these professionals are taking. I didn't hear the minister make any mention of steps that she is taking in order to ensure that that emergency room is accessible. She has, repeated old announcements around educating nurses. We know the minister is well aware that it takes years to educate those nurses in post-secondary education and get them ready for the workplace. And I've had some really interesting conversations with new grads who are excited to be in the workforce and are having an incredibly challenging time in the workforce because there has been a loss of expertise in our healthcare system. Nurses are still leaving the healthcare system, so there's a lack of mentorship due to the lack of retention because the government hasn't made meaningful efforts to retain nurses. And, there's a risk there that we're gonna have new grads entering a healthcare system without the supports that they need to wanna stay in it. I've also talked to new grads who have left Manitoba because they have plainly seen this government fail to make any meaningful effort to recruit them into the healthcare system here in Manitoba. So I hope that the minister hears what I'm saying and just is able to actually utilize what I'm saying based on my conversations with new grads and with nurses we want to retain in our healthcare system, and put that feedback to good use in terms of a strategy to recruit and retain these nurses. Now, specifically, the minister talked about Powerview Pine Falls and the challenges there and what the Regional Health Authority is doing to address it, but she neglected to talk at all about my question in regards to obstetrics. The folks who are part of the We Want Birth Committee, they're in Flin Flon. I know that they would love to hear an update from the minister on this particular issue. The folks in Thompson, in the PAW, who are significantly impacted by the fact that there's staffing challenges in obstetrics and are being forced to leave their communities to have their kids. This is an important issue. The minister should, at the ready, have the information available to her to let us know currently what the staffing situation is for obstetrics in Thompson and the PAW. So I pose that question to the minister again. What is the current staffing situation for obstetrics at Thompson and the PAW?
The Honorable Minister of Health.
Thank you, Mr. Chairperson. I would like to add to my comments earlier about in terms of what is our government specifically doing to support these facilities and emergency departments. And I just want to cite one example of a solution that came from the hospital floor, an emergency department at HSC, where the idea for the physician in triage came forward right from the hospital emergency department and required a $1.2 million investment, and our government came alongside that suggestion and to ensure the funding was available. Also, I want to just go a little further back in time to last year when I joined the honorable member for Beausejour, and to announce 9 family physicians had started practice in communities across the Interlake Eastern Regional Health Authority. So 4 of the new physicians were graduates of the 1-year medical licensure program for international medical graduates offered through the University of Manitoba, a program that's designed to integrate physicians who have practiced internationally into the Canadian medical system by allowing them to gain a better understanding of the Canadian local healthcare system. The program has allowed physicians who have practiced internationally to better understand the needs of rural patients and the variety of healthcare services people require. Those graduates would be working in rural and underserviced areas of the province, and they had actually made a 4-year commitment to the region. So our government is supporting these programs to ensure that we get health practitioners and family physicians trained and working in rural communities. I also want to reference our undergraduate nurse education program, where we're trying to ensure that new graduates or individuals that are still in their program develop roots right here in our province by allowing 3rd and 4th year students to come into our health system to begin working while they're still in their academic training. And I'm told that over 60 individuals are participating in this program. So our government is taking steps to help individuals to develop deep roots and to not go to another province. And then I will be so pleased next month when we welcome a number of graduates from the University College of the North nursing program. I understand that several will be accepting their graduation certificate right in Thompson, where they are going to continue to practice. And we are encouraging individuals to be trained in the University College of the North and to continue to serve in that area. With regard to obstetrics, our clinical preventative services plan knows the need to engage on women's health, and specifically obstetrics and women's gynecology and all the spectrum of services that women need. They want to ensure that services are provided close to home and in safe circumstances. Those discussions are underway. I had shared before that we had asked Deloitte to do a review on our women's health program that included in the northern and remote and rural communities. And we look forward to using that information to inform the work that is being done, but through the clinical preventative services plan to ensure, just like the member for Union Station has stated, that obstetrics and a range of services for health services for women are available close to home, and that they receive those services under safe circumstances. And I look forward to hearing more about the We Want Birth Committee and the work that they're doing, and always willing to see recommendations and suggestions that come forward. There's no monopoly on good ideas. Mr. Chairperson. And so if there are ideas coming forward, please send them to my.
The honorable minister's time has expired. The member for Union Station.
Can the minister tell us how many day surgeries were conducted in the northern region last year?
The Honorable Minister of Health.
Thank you, Mr. Chairperson. I thank the honorable member for Union Station for the question. The goal, and I've heard this from many individuals who've undergone surgeries, that they want the most minimally invasive procedure to be done. Generally, most people want to recover at home, so looking for outpatient options. I can report that 90% of surgeries are same-day cases in the region. That would include Thompson, the Paw, and Flin Flon. And that is the number that I can provide, Mr. Chairperson. Thank you.
The member for Union Station.
Can the minister take as an undertaking to provide us the number here on how many day surgeries have been conducted in the northern region as of last, or were conducted rather in the northern region last year?
The Honorable Minister of Health.
Mr. Chairperson, thank the member for the question. We will endeavor to try to get it during, get that information during this committee of supply today. And if not, I will take it under advisement. Thank you.
The member for Union Station.
I thank the minister for agreeing to either provide that information today or taking it as an undertaking. I appreciate that. The minister has no doubt seen the recent concern in the media about access to healthcare in the Interlake. I've already raised that. I've given a couple of examples, and the minister has provided some information by way of response. This has been a problem for some time. This is something that folks in the Interlake have raised issues and concerns about. And certainly we're seeing some pretty concerning challenges arise, and it's incredibly important that steps are taken now to mitigate some negative outcomes in the short term, but certainly long term as well. More often than not, we know that a doctor is not available specifically in Eriksdale or in Arborg. What is the minister doing to address this particular issue?
The Honorable Minister of Health.
Thank you, Mr. Chairperson. I would like to go back to the honorable member for Union Station's question about obstetrics and access to birthing in the north. I'm advised by the Northern Regional Health Authority specific to the Thompson General Hospital that no transfers to Winnipeg for birthing has occurred unless it was due to clinical assessment that the individual needed to be transferred to Winnipeg as a result of their specific birthing situation. Of course, if it was high risk and the person needed additional care, possibly maybe even the baby upon being born, perhaps would need, as an example, to be in the NICU. But I'm told that from the Thompson General Hospital, no transfers to Winnipeg for birthing has occurred. And if they have, they're due to clinical assessment and a transfer is required. I also want to reference the members' comments again about Ericsdale and Arberg and specifically the Interlake Eastern Regional Health Authority, or the Interlake region. Like most rural regions in Canada, attracting and retaining family physicians has been a challenge for the Interlake and Northeastern communities. And that is why we're training family physicians in rural communities to expose them to both the benefits and specific challenges of providing healthcare to smaller communities, while also ensuring quality care for rural communities. So this partnership with the University of Manitoba is so critical to our ability to train and recruit right into our communities. And so recruitment efforts by the region and private clinics are seeing new physicians begin practice in Beausejour, Ericsdale, Lac-du-Bonny, Toulon, and Selkirk, among others, with internationally experienced medical graduates working in Ashern and Pine Falls. And this was last year, and Pine Falls is identified here, as well as Ericsdale and surrounding communities. And those family medicine physicians work as part of a team to provide access to primary health care and robust emergency department coverage in rural communities. And I just want to recognize the hard work of our region's physician recruitment and retention team and our local physicians who develop, the local physicians there who are developing relationships with physicians in training. And they're creating a welcoming environment and showcase various practice opportunities in the area. And this really speaks, Mr. Chairperson, to the success of rural-based training and recruiting new practitioners. And I also want to thank the regional residents for their warm welcome to new practitioners, making sure they feel comfortable in their new home. I think it's a combined effort to aligns well with our mutually agreed upon strategic goal in that region of developing health human resources within the region. And again, residency, as we all know, is the last stage in training for doctors following their graduation from medical school, and the family medicine residency program at the University of Manitoba's Max Rady College of Medicine includes training in a number of practice areas, including primary care, psychiatry, obstetrics, general surgery, internal medicine, emergency department care, pediatrics, and seniors care. And I just want to thank all the local doctors and staff for their support of these new students and for their support of the region where they work. And we are going to continue as a government to support this initiative through the University of Manitoba's Max Rady College and the physician recruitment and retention team led by local physicians in the Interlake Eastern Regional Health Authority. It's by working together that we will address these issues that are occurring on the ground. But our government remains committed to ensuring not just Interlake Eastern Regional Health Authority, but all regions receive the support that they need.
Honourable Minister's time has expired. The member for Union Station.
Thank the Minister for that response. I can hear my northern colleagues in my ear right now demanding that I ask for clarification and telling me that Thompson is not the only place in the north. And so the Minister referenced Thompson in her response in terms of people not being transferred from Thompson to give birth. Can the Minister also provide clarity as to whether or not people have been transferred from the PAW, from Flin Flon, from other northern communities, and to give birth because they could not access that care in their own communities.
The Honorable Minister of Health.
Thank you, Mr. Chairperson, and for the individuals that are sitting within earshot of the honorable member for Union Station. I want to be clear that I recognize that Thompson is not the only community in the north. The member had asked about two specific communities. One was Thompson and the other was the Paw. The information was transferred to me while we were in this committee of supply day with regard to Thompson. And so I felt I would bring forward the information specifically for Thompson while we continue to request the information the honorable member for Union Station had asked for the Paw. If the member is now asking for us to expand that list, we will take that under advisement and come back with a response with regard to the additional communities they have added to the list. But certainly my attempt was to provide in an efficient and timely manner information about Thompson that had become available during this session. It is in no way meant to disrespect the North by focusing just on Thompson or leading anyone to believe that I or in any way feel that that is the only community. I've traveled the North extensively in my time working for the Winnipeg Regional Health Authority over 12 years. And I'm very familiar with the North. I've gone as far as Wasagamak, Garden Hill, Red Sucker Lake, many different communities, and spent time in Thompson, Pine Falls that we've talked about today, Snow Lake, all over the North. And I'm very familiar with the various communities. So again, it was my attempt, no disrespect to any members that represent the northern communities, my attempt to answer a question that the member posed about two specific communities, and that can be checked on the record. It was Thompson and the Paw. Thank you, Mr. Chairperson.
The member for Union Station.
I thank the minister for agreeing to provide further information. To be clear, I was ensuring that my colleagues were well aware that I would advocate for greater information from more northern communities. I wasn't implying that the minister only recognized Thompson as being, the only community in the north. So just so the minister is clear, that I was ensuring that I was raising this on behalf of my colleagues. As I stated previously, I could literally hear them in my ear, making sure that I'm advocating for the information to also be brought forward for additional communities that they represent and represent very well. So I appreciate that the minister was trying to provide information that she had available. I would ask that if the minister is able to provide more information as she receives it in this committee, that would be great. I would welcome that, but certainly understand that if an undertaking is necessary to provide the fulsomeness of that information at a later time, I think that's great. I appreciate the minister being willing to do so. So I would like to ask a question about some of the concerns around paramedicine times that have been raised and in the media lately, and that different organizations have been advocating very, very consistently on. I think about the Manitoba Allied Healthcare Professionals. That organization has been, raising concerns around this particular area for quite some time and have been very vocal about this very important issue. We've raised concerns about ambulance response times in the city of Winnipeg as well as rural Manitoba. And we know that response times have increased 35%. I did raise this in the House very recently, as I'm sure the minister remembers. So it's concerning everywhere, ultimately. In the Interlake, response times are now above 15 minutes, which is the clinical standard, and that's very concerning. My question is, what is the minister doing to address these very concerning response times that are well above and beyond what they should be?
The Honorable Minister of Health.
Thank you, Mr. Chairperson. I thank the honorable member for Union Station for the question about paramedicine and our paramedics. And of course, this is paramedics service a week. And I had the opportunity this week to rise in the chamber to just thank our paramedics and first responders for the incredible work that they do to provide supports to individuals and families. They're usually first on the scene of injuries and accidents. I know on a personal level, my husband's friend in the industry that he works in was in a tragic workplace accident last week, and the individuals that were on the scene said when the paramedics arrived, the amazing care that they provided, and just consoling, not just taking care of the patient, but consoling those who were on site to witness the horrific, tragic workplace accident that occurred. So this week when I rose in the chamber, it was everything that I said was truly from my heart, because I know that they're quite often on the scene of very emotional and tragic situations, and so our government wants to support them, and that is why in budget 2022 we've included the hiring of 30 full-time primary care paramedic positions, which is an investment of over $4 million. And further, our government is increasing call volumes in the emergency response system with an investment of over $3.5 million. So that's a total of $7.5 million. And we've also purchased 65 new ambulances to refresh approximately 1/3 of the province's fleet. We continue to develop our EMS infrastructure, as seen by the $3.8 million investment for EMS stations in Portage La Prairie and Crystal City. I know that while I was announcing the opening of those 2 new EMS stations, I spoke with a paramedic who was on site, new paramedic to the system, and she said that what attracted her to the role was some of these new investments that we're making in terms of new equipment, new stations. So we see this as being an avenue or a mechanism to bring those individuals to the system. And of course, I refer again to budget 2022, which continues the $812 million investment, the largest single healthcare commitment in Manitoba's history, to improve rural and northern healthcare through the clinical and preventative services plan. And I know that some may be tired of hearing me talk about this, but it impacts so many different areas of the health system that I want to continue to bring us back to it. It's a historic investment. It will help emergency medical services and patient transport, and it will reduce the need for Manitobans to travel long distances for care by providing more services closer to home. So we're going to continue to look at the response times. We want to keep our paramedics well, emotionally, physically. And again, I would just want to recognize their tremendous contributions during Paramedic Services Week. And the theme is Faces of Paramedicine, and it's focusing on the many roles of paramedics. And truly, I'm just so grateful for the paramedics that are in our system and providing care, as I said, to individuals and families, consoling loved ones. It's more than just care to the patient. It's the range of services and that they provide is truly, Mr. Chairperson, commendable. So again, congratulations to all our paramedics on Paramedic Services Week 2022. I was pleased to proclaim it as well. And the Paramedics Association has put that up on social media. And I will continue to be a health minister that stands beside you and supports you in the work that you're doing in our great province. Thank you.
The member for Union Station.
So I've gotten some very concerning new information in regards to the emergency room wait times, the most recent ER wait times. And what we're seeing in terms of these wait times continuing to go up is deeply concerning, deeply concerning. I've previously asked the minister about what steps she is taking to address these ER wait times in our emergency rooms that we know are resulting in folks leaving the emergency room without ever being seen after waiting hours and hours and hours on end. 14% of all patients in March of this year who visited emergency rooms left without being seen or receiving any care. 24% of all patients left the Health Sciences Center emergency room without being seen or receiving care. Incredibly concerning. And now we know that for the month of April, not only did the ER wait times go up at HSC from 10.5 hours, which is historically high, astronomically high, we also now know that the wait times have gone up to almost 12 hours, 11.92 hours at the emergency room at Health Sciences Center. 12-hour wait times. I mean, this is really scary stuff that we're seeing here and has very real impacts on the staff who are trying to provide care and, of course, the folks that they care most about, the Manitobans who are trying to access emergency care. My question for the minister is, when will this peak? Does the minister think that Manitobans should just expect that these wait times month over month are going to continue to go up and that the number of people we see leaving emergency rooms without being seen is also, as a result, going to go up? And therefore, the health outcomes for Manitobans will get worse? Is there an end in sight to this increase in these hours? So my question to the minister is, when does the minister see this peaking, and at what number? Month over month over month, the ER wait times are increasing. Now we know in April, 11.92 hours, 12-hour waits at HSC. What does the minister see happening here in coming months here at HSC and in emergency rooms across Winnipeg?
The Honourable Minister.
Thank you, Mr. Chairperson. Can I request a 5-minute break, please?
The Minister's requested a 5-minute break. Is that acceptable to everyone? Agreed. I'll set the timer. We're just going to wait for a couple more minutes, Minister, until the member for Union Station returns. I'll let you know when she's back, or when they're back. Yeah. All right, the member for Union Station has returned. Recess is over. The Honourable Minister, if you're ready to proceed, you can go ahead.
Thank you, Mr. Chairperson. I'm pleased to put on the record further measures that are being taken to address emergency and urgent care wait times. I want to begin by saying that Winnipeg emergency departments and urgent care centers continue to implement new and expanded initiatives designed to improve patient flow as Manitoba's health system responds to long wait times for many patients seeking care. And I want to share what some of those measures are. Leveling of ambulance transport arrivals across facilities. This change to ambulance transport protocols is shifting appropriate lower acuity patient arrivals to urgent care centers rather than emergency departments, easing patient flow challenges at acute care facilities while improving patient safety. Use of the physician and triage model of care, which places a physician in the triage area to manage and provide care for those waiting to be seen, with a particular focus on higher acuity patients. The physician and triage model began in late April as staffing has allowed. Discussions are ongoing on expanding the pilot program, of course, to St. Boniface and Grace Hospital. And I also want to talk about other initiatives, new initiatives launched this month of May. The expedited placement of alternate level of care patients from hospital to long-term care. This is freeing up space in inpatient units for admissions from emergency and urgent care. Alternate level of care patients are frequently long-stay inpatients that could be appropriately cared for in other settings with appropriate supports. There were 112 alternate level of care patients in Winnipeg hospitals on Wednesday, down considerably from April when the daily average was 151. Also another new initiative, repatriation of stable patients who live outside of Winnipeg to continue their care when clinically appropriate to sites in their home health region. So as of Thursday morning, 162 patients have been repatriated to sites in their home health region this month. And this is freeing up space at Winnipeg inpatient units for others while allowing patients to continue their recovery at sites closer to home and their support network. There were 139 patients repatriated in all of April. And then improved collaboration between community and facility-based teams. So as staff that support community and home care are returning to their normal work following COVID-related reassignment or redeployment, teams have prioritized the arrangement of supports at home or in the community for patients, allowing them to be safely discharged more quickly and opening up space in medicine unit for others. And preliminary data suggests the implementation of these and other initiatives have started to positively affect patient flow at Winnipeg sites. Decrease in various wait time metrics over the past 12 days. And the health system has also benefited from reduced sick rates over the past month, which has bolstered inpatient capacity, as well as the return of redeployed staff to community and home care duties, which is crucial in providing hospital inpatients with the necessary supports to continue their care at home. And Mr. Chairperson, I want to assure the honorable member for Union Station that system leaders from both Shared Health and the Winnipeg Regional Health Authority continue to meet with staff, physicians, and site leaders to discuss their concerns and share ideas on how to further improve patient flow and reduce wait time. And work also continues to recruit and retain healthcare workers, including nursing staff at all the sites, Mr. Chairperson. And patients are reminded, I want to put this on the record, to continue seeking help in emergency, either by calling 911 or going to an emergency department or urgent care center. All patients are assessed and triaged upon arrival, and care will be provided with the sickest and most injured patients prioritized.
The Honourable Minister's time has expired. The member for Union Station.
I'm sure the minister can appreciate that citizens are very concerned about what is going on in our emergency rooms. Increasingly, they're seeing stories of nurses and healthcare aides who are burnt out, who are leaving our emergency rooms, leaving with all of their expertise and dedication and moving on because they simply cannot manage the overwhelming workload. They're terrified that they'll lose their licenses and won't be able to practice in the field that they absolutely love. Some folks have left the profession altogether because they simply cannot practice in their chosen profession, which they do love under this government. All of these things are incredibly concerning for Manitobans when they read these things in the news and continue to see, despite this minister and this government making announcement after announcement after announcement, these ER wait times continue to go up and up and up in the wrong direction. The impacts are real. Can the minister provide for us whether or not she can communicate to Manitobans what this means for them accessing emergency rooms? Does this mean that they should come to expect that ER wait times are going to go up to 13 hours, to 14 hours, to 15 hours, to 16 hours? A 12-hour wait time on average for the month of April at HSC is a really scary number. It's a really serious number. Continues to trend up. Does the minister think that this wait time at HSC has now peaked, or does the minister think that this wait time and these wait times at HSC emergency room are going to continue to go up and peak at 13, 14, 15, 16 hours? Can the minister provide her perspective as the Minister of Health on that specific point?
The Honourable Minister of Health.
Thank you, Mr. Chairperson. And, you know, I want to assure the honorable member for Union Station that I am concerned, my department is concerned about the high wait times. And this is a priority. I take this very, very seriously, and so does our government. And it is our goal and is to ensure that the system leaders from both Shared Health and WRHA continue to meet with staff, and they are. And they're being very transparent. They have just posted information on their website to make Manitobans aware of how things are progressing. They have shared the very publicly the measures taken to address the emergency and urgent care wait times. I understand that they were out earlier today, about an hour ago at 3:30 p.m., speaking in person to the media, sharing the work that is being done. They continue to talk with staff, physicians, site leaders to discuss their concerns, share ideas on how to further improve patient flow and reduce wait times. These wait times and patient flow issues are not government specific. They're not new to our government. They existed under the NDP government's time in office. The ER wait times were referred to as a crisis. Grace Hospital, and no disrespect or to any of the individuals that work at that site and do incredible work on behalf of Manitobans, but had the longest wait times in the country. That was under the previous NDP government's watch. And our government has just come through, worked with Manitobans and health system leaders and those on the front lines to navigate 4 waves. I understand it was actually 6 because they refer to the Omicron and the BA2 variants as also waves. 6 waves of COVID pandemic. And we know that the reason for the increased wait times at our emergency department is multifactorial. And individuals may have waited over the time of the pandemic, didn't receive care. So now they're showing up at the emergency department, they're sicker than if they had received care during the pandemic. And we're not saying they shouldn't show up there. We are saying that we've had high sick times. We see those numbers coming down. We had over 500 healthcare workers redeployed, mostly critical care nurses, to ICU and critical care services. We've now returned all of those individuals to their program area. Everything is coming together to relieve those pressures on the emergency department. This morning, I had the pleasure of talking to a physician assistant group. A number of individuals were from my constituency, and some are working in communities, some are working in health facilities, and they're again at the table of solutions, talking about how we can utilize the services of physician assistants to address the ER wait times. So we're hearing in my office and in Shared Health, in the CEO of WRHA's office, at those working group tables, solutions from many different specialties to address the pressures on our emergency department. It's not about blaming and shaming. It's not about making individuals feel that they're not doing enough or they're not doing anything. They are, and we appreciate as a government all the efforts that are being made. And I've invited many times members opposite to come to the table of solutions. Write to me, meet with me. My office is always open to the member for Union Station to come in and sit down and share what are some of the solutions that we haven't thought of. The member worked in the system. I worked in the system. Let's be solutions focused. And let's get away from this blaming and shaming, because that's not what Manitobans need during this critical time. What they need is harmony and collaborative approaches to addressing an issue that was not created now, but
The
needs to
Honourable
be.
Minister's time has expired. The member for Union Station.
The minister's response, I'm just going to be frank here. The minister really and truly needs to recognize that what Manitobans need is a government that is accountable and a minister of health that is accountable to the decisions that they make and that they have made that have been detrimental to our healthcare system and the health outcomes of Manitobans. It is actually deeply problematic and concerning, worrisome that this minister and her caucus want to point fingers at absolutely everyone else and place blame with everyone else in terms of why our healthcare system is beyond a state of crisis. This minister enthusiastically will go back almost 2 decades and highlight issues under former governments. This minister will point to COVID as the reason why things are so challenging in our healthcare system. This minister refuses to recognize that since 2016, her government has made decisions, intentional, strategic decisions to cut healthcare to the point where we could not respond to a pandemic. Cut healthcare before COVID ever reached Manitoba to the point where morale amongst healthcare workers was at a historic low. Nurses in our emergency rooms were already pleading for help, begging ministers of health, many of which there have been failed ministers of health before this minister, to come and see what they were dealing with and take appropriate action. It is so concerning that this minister continues to point the finger elsewhere and refuses to look at the decisions her government has made. Because if she is unwilling to do so, it means they will not learn from their mistakes. They will continue to repeat them and continue to harm Manitobans as a direct result in our healthcare system. Accountability is not about placing blame. I say that sincerely to the minister. Accountability is about being able to earnestly reflect on decision making, learn from decisions made, and improve so that things get better for Manitobans. And Manitobans recognize that, which is why this rhetoric that the minister continues to try and put on the record and spin time and time again is so tired. It is unproductive. And it is actually just creating more and more of a disconnect for Manitobans. They don't trust this minister or this government with their health care. Because this government won't own up to their mistakes in healthcare. There are nurses who are actively leaving emergency rooms. They cannot work there any longer. What is the minister doing to retain nurses, actively doing to retain the nurses we still have working in our emergency rooms and working at the emergency room at HSC, where we're now seeing historically high emergency room wait times of 12 hours.
The Honorable Minister of Health.
Thank you, Mr. Chairperson, and I just want to reinforce once again that there is work being done. I've shared with the Honorable Member for Union Station $1.2 million invested in the physician and triage program. That was an idea that came forward right from the hospital floor. Our government came alongside those individuals that brought forward that solution with that investment to address the wait times. And, you know, I think we go through over an hour of question period in the chamber every day. And the member is given an opportunity to pose these types of questions. They're answered by myself there. This is Committee of Supply. This is an estimates review process. We have steered completely away from the estimates or asking any questions related to the estimates document. We have made this into a question period session. I would be happy to answer questions from the Honorable Member for Union Station that are typically and generally asked in Committee of Supply. I recognize that the member is new to the political process, but again, I'm happy to answer estimates related questions. And I know that we do have several more days of question period to come. Perhaps the member could pose these questions during question period over the next few days that we will be sitting in the chamber. Thank you, Mr. Chairperson.
The member for Union Station.
Can the minister provide me with the funding amounts provided to the Winnipeg Paramedic Services over the last 3 years? So 2018, 2019, 2019, 2020, and 2020, 2021.
The Honorable Minister of Health.
Thank you, Mr. Chairperson. I do want to go back to the Honorable Member for Union Station's previous question about day surgeries at our northern facilities. I do have that information available for the member. Well, let's start with Flin Flon General Hospital, 2017, 2018. 657, and these are day surgeries also, by the way, 657, 2018, 2019, 490, 2019, 2020, 487, 2020, 2021, 235, St. Anthony's Hospital in the Paw, 2017, 2018, 445, 2018, 2019, 421, 2019, 2020, 406, 2020, 2021, 320, Thompson General Hospital for 2017, 2018, 1,344 for 2018, 2019, 1,434 for 2019, 2020, 1,196 for 2020, 2021, 869. And I'm pleased to provide the totals by year. 2017, 2018, 2,446 for 2018, 2019, 2,345. For 2019, 2020, 2,089. For 2020, 2021, 1,424. Thank you, Mr. Chairperson.
The member for Union Station.
I thank the minister for that response and for providing that during this committee. I'll repeat my previous question in case the minister has forgotten it. Can the minister provide me with the funding amounts provided to Winnipeg Paramedic Services over the last 3 years? So 2018 and 19, 2019, 2020, and 2020, 21.
The Honorable Minister of Health.
Thank you, Mr. Chairperson. I am pleased to respond to the honorable member for Union Station's question. I do want to clarify the time periods provided by the member are not the last 3 years. So the last 3 years is 21, 22, it's 2021 and 19, 20. So this information is provided by Shared Health because we do not fund them directly. So I will start with 2019, 2020, 44,931,000. 2020, 2021, 47,327,042. 2021, 2022, 48,693,542. Is that, are those 3 time periods what the member is seeking? That would be the last 3 years. Thank you, Mr. Chair.
The member for Union Station.
I thank the minister for providing that information. I apologize for misspeaking. She is correct in providing that information, and the correct years were provided. So I thank her for that. I'd like to ask about radiology in Brandon. So we've heard concerns that the machine, the radiology machine in Brandon is broken. At what point earlier this year, both radiology machines broke at the same time. So they were not operational at the same time, and scheduled appointments unfortunately had to be canceled. Can the minister tell me what plans are in place to replace the aging radiology machines there and when that might happen?
The Honorable Minister of Health.
Thank you, Mr. Chairperson. I'm needing to seek clarification from the member for Union Station. What type of radiology machine?
The member for Union Station.
The fluoroscopy machine.
The Honorable Minister of Health.
Thank you, Mr. Chairperson. While I request that information, I do want to put on the record that we do have a committee of radiologists that meet annually to prioritize the diagnostic imaging machines and what needs to be done, what needs to be replaced, what is dated and is no longer applicable to be used in the system. It's called the Provincial Imaging Advisory Committee. So we are looking up the information that the honorable member for Union Station has requested for that particular machine, because the decision is being made by a provincial body. And we should have that information available shortly. But again, they meet annually to prioritize the machine, and we are attempting to get the information about the fluoroscopy machine that the member has referenced.
The time being 5 p.m., I'm interrupting the proceedings. The Committee of Supply will resume sitting tomorrow morning at 10 a.m. Thank you.